All right, let's be honest. Who here hasn't typed a weird symptom into Google at 2 in the morning? We've all been there, right? For years, that meant falling down this crazy rabbit hole of confusing and frankly terrifying articles. But that's all changing, and it's changing fast. Today, we're going to break down how Dr. Google is finally learning to talk back and what that actually means for all of our health journeys. So just think about it for a second. You've got that strange symptom, a nagging pain, or you just feel off. What is the very first thing you do? For most of us, it isn't calling a doctor. Nope, it's reaching for our phone. And for the last 2 decades, that search has looked exactly the same. We type our deepest, darkest health fears into a search bar and get hit with a wall of blue links. We'd end up sifting through forums, dense medical jargon, and articles that, let's be real, usually left us way more anxious than when we started. We were completely on our own. But that entire experience, it's being completely reinvented. You see, the search box is becoming a chatbot. Instead of just throwing a bunch of links at us, it's starting to give us actual answers, a direct, conversational summary, and that changes the entire game. So, how does this new way of searching for answers really work? Because it's a fundamental change. It's not about finding a website anymore. It's about making sure your information becomes part of the AI's answer.
To really get your head around this new world, you need to know this acronym, LLMO. It stands for Large Language Model Optimization. You can basically think of it as the new SEO. It's no longer just about getting clicks. It's about proving to an AI that you are a credible, trustworthy source of information.
Look at the difference here. The old world of SEO was really just a game of popularity. It was all about keywords and backlinks. But LMO, that's a game of credibility. The goal isn't to be the #1 link anymore. No, the real prize is to be the source that the AI quotes directly in its response. It's a massive shift from just being popular to being truly authoritative. So how does an AI even decide what's trustworthy? Well, it looks for some very specific signals. It gives a ton of weight to information from recognized authorities, like the CDC or the World Health Organization. It scans for clean, structured data that it can easily understand. It checks that a brand's name is used consistently across the web. And this is a big one, it really rewards original, verifiable research. Let's make this real with a quick example. So there was this supplement brand, Health First Labs. They were getting totally buried in AI answers by the huge names like the Mayo Clinic. So what they do? They went all in on an LLMO strategy. They cleaned up their website's data, they actually funded and published a real clinical study, and they got mentioned by other trusted sources. And the result? The AI started citing them directly, weaving their brand right into the answer it was giving people. Pretty cool, right? Okay, so we've seen how AI can help us find credible information. But what happens when we're actually ready to buy something? Let's take a look at how AI is stepping into the role of a personal shopper for your health. I want you to meet Rufus. This is Amazon's new AI shopping assistant. It's designed to be a conversational guide. And get this, it learns from literally everything on a product page. The official description, all the customer reviews, and every single question people have asked. So instead of just searching for blood pressure monitor, you can actually have a conversation with it. You might start by asking something more natural, a question that focuses on a specific need you have, like, hey, what's a good easy-to-use monitor? And Rufus doesn't just spit out a list of products. It synthesizes information. It can read through hundreds of reviews and notice a pattern, like, hey, people are constantly saying this one CVS model is super simple, just one button. And boom, that's the answer it gives you. But the conversation doesn't have to stop there. Just like you would with a really helpful sales associate in a store, you can dig deeper. You can ask follow-up questions to get the exact details you care about. So, by pulling these specific little details from user feedback, the AI can answer really nuanced questions. And this brings us to an absolutely crucial point for any brand out there. Every single word on your product page, from the bullet points to the customer Q&A, is now training data for an AI that is actively recommending products to people. Okay, so AI can help us find info and products. But what about understanding our own health data? The information we are generating every single day from our wearables. Wearable devices have gotten incredibly good at measuring stuff. Our heart rate, our sleep, our recovery. But their biggest weakness has always been interpretation. This quote just nails the next big step perfectly, making that data conversational. Your wearable is finally talking back.
This is a huge shift. We're moving away from these complex data dashboards that, honestly, we have to try and decipher ourselves, and we're moving towards simple conversational interfaces. It's the difference between being a passive data tracker and having an active, AI-powered health coach right in your pocket. Just imagine this for a second. Instead of staring at a bunch of confusing charts, trying to connect the dots yourself, what if you could just ask your wearables app a direct question? Why was my recovery so low today? You'd get a real, actionable insight in plain English that's drawn directly from your own personal biometric data. And that brings us to the final stop on this journey, which is where all of this amazing technology plugs back into the formal healthcare system itself and totally changes how we interact with our doctors and clinics. And you know what? This isn't some far-off future thing. It's happening right now. Patients are already embracing AI for all the practical stuff. Look at this data. We see huge adoption for tasks like scheduling appointments and requesting refills. We're talking over 2/3 of patients are already using AI for these things, and that frees up so much valuable time for clinic staff to actually focus on patient care. And if you want to understand the scale of this, just look at this number, 42,000. That is how many patients have already used an AI intake platform at just a single hospital system, Cedars-Sinai. This isn't some tiny pilot program. This is a massive, real-world deployment happening right now. So when you put all these different pieces together, how we find information, how we buy products, how we understand our own data, and how we interact with our doctors, a whole new picture starts to emerge. And that brings us to the new reality for every single health brand, hospital, and information provider out there. As one expert put it so perfectly, it's no longer enough to rank #1 on Google. The real challenge is to rank in ChatGPT. The entire definition of what it means to be visible has fundamentally changed. From the way we learn, to the way we shop, to the way we manage our own well-being, this conversational shift is changing the very nature of our personal health journey. So the big question now is, what are you going to ask?